There's the local turn inward, ingrown kind of local, and that's not what I was talking about, but where you really capture the distinctiveness of the resources, and that's incorporated in the curriculum and the thinking, and you described that perfectly.
And I think the beauty of having that too for a School of Nursing is that it's open to other schools, so we benefit from the experience of other colleagues who come, students and faculty. The School of Dentistry is there, social policy and planning is there, medicine is there, Wharton and business school are also there. So the students, that cycle of students coming in and seeing all that is benefits the program. They are benefit from it and really informed our teaching. I really think we have the many pieces, and that's what my advice for a dean would be about, is to do what you can to garner and to leverage the best capacity of your faculty. So know your faculty really well and know their capacity, and know that diversity is very important. Diversity in intellectual endeavors, in theoretical frameworks, in paradigms, diversity in race, diversity in culture. It's that diversity that's essential for creating a curriculum for the future. And I think what administration is about is to find out those best different capacities and support it so it grows to the maximum of its ability to perform at its best.
I did want to contextualize what the students were learning in their sciences, and we do have the luxury of having our own faculty who are scientists themselves, a chemist, anatomists and physiologists who do teach our introductory science courses. And what we wanted to do, though, was add a component to help students really understand why this content was so important. So they take a course in cell biology, and one of the first classes really talks about the cell membrane and how it's composed and what its function is. And then to help students understand the importance of knowing what a cell membrane is and the fact that it may have an impact in their clinical practice. There may be medications that affect it. So we would have what we call a recitation, where students might have some review work. That's part of it, but the primary focus of the recitation is to present a case study. And we have Annie Weslowski, who has developed these case studies, and she's really taken a clinical situation, for example, cystic fibrosis, had enough information in this case so that students would understand what was happening. To understand, these are freshman students. They don't have a lot of clinical background yet. But the cases, and I was a little leery initially, I have to say. I was a little worried that we'd get them in over their head and they would have no idea what the cases were about. But I think Annie has done a great job of just finding that level that gives students enough information that they get the clinical feel of the situation, but begin to see why the science is so important. So she'll do the case study, for example, on cystic fibrosis, where the problem is within that cell membrane. And she'll talk about the symptoms that you see and why a dysfunction in the cell membrane would cause those symptoms. And it really, I think, helps students contextualize that learning, and I think helps reinforce it. And we are hoping that it helps them remember this information as they move forward in their program.
What made it work so well is that all the faculty were involved. Now, how do you bring faculty who don't want this into the fold? You involve them in the discussion. And we took what they were saying we took very seriously what they were saying, so that they were able then to provide input into the course development and to the course description and to the course objectives, so that we really brought everyone in. What we would do differently is that we always said we were focusing at the 50,000-foot level, and let's not worry about anything right now. Let's just focus at the 50,000-foot level. What is your ideal curriculum? We forgot that we really do have to implement this, so that there are some things that we haven't been able to do, not very many, because so far it's really worked out very well. We're having to relook at some of how the research residency is going to be implemented. But those issues really are they're doable. So that that's what I would say if we did it all over again. It's just that sooner or later you're going to have to deal with it coming down to the ground level. So I don't think that it hurt for us to think up there.
One of the things that's unique and I think very strong here at Penn is that you have in your science faculty people who are trained in that science.
Yes.
And now with the new curriculum, you're really pairing those scientists with nurse clinicians to do some bridging and translational work.
Exactly.
Can you describe that a little bit? Because I think that's one of the really intriguing aspects. I know it's not what you've been directly involved in, but I know that we will be observing some of that in the classroom.
Well, for example, Dr. Connie Skanga, who teaches our anatomy and physiologist, is just a brilliant anatomist. And she's teaching, for example, skin. You know, what is the structure of skin, what is the physiology of skin, and then she hands it off to Tamara, who says, the reason skin is important, the reason nurses own skin, is because of wounds and wound healing. We try to pick paradigmatic cases because we can't teach everything. And so she talks about wounds and wound healing. And then they go into the lab to look at how do you assess wounds? You know, how do you look for signs of infection in wounds? You know, how do you, they're also in micro, where they're learning sterile technique. How do you create a sterile field when you need to dress a wound? So that kind of tight integration is really one of the hallmark characteristics.
And that was our real dream, to see that come to fruition in the Carnegie study, to see knowledge acquisition and knowledge use really paired like that.
Our next step is going to be to work with our clinical faculty,
Right.
who take our students actually into clinical, and to engage them in our vision of what happens in clinical.